Good morning. Calling Human Services Committee to order and ask that you please stand and join with me in the pledge to flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. It looks like the agenda has public health first. It's never the same.
Thank you. You can steal one. You want me to pass those down?
Morning, Linda.
I actually would like to call your attention to a flyer you have. I emailed it to you as well. We're offering on December 15th a free hepatitis C testing day at St. Joseph's. Hep C, if you're in that age group, from 1945 to 1965 you were born. Highly recommend that you do it. Blood wasn't tested as well back then. If you've ever even had a blood transfusion, you could have this. It could remain dormant and you wouldn't know. And the big push for it now is there's a much better treatment out there that is very effective. And if you did test positive, there's a great chance that you would have better longevity. Hep C is the #1 cause of liver cancer. Or one of the highest causes, I probably should say. I also have 2 resolutions, and I apologize that I didn't get them to you in advance, but they just came out. And one of them is Dave Blades' county, or township, I'm sorry, and it is through Creating Healthy Places, and we need a resolution to purchase bridging material for a 70-foot wetland bridge for the Thrall Dam property of Essex County. It's being purchased by Creating Healthy Places, and the materials for the project are up to $15,000.
I'll move that one. Seconded by Mr. Preston. Discussion?
Sure pays to be the Human Services Chair, doesn't it?
All in favor? Aye. Opposed? Carried.
And the other one I have is recently we learned of Creating Healthy Places grants going away. It's the end of its 3-year term, and they came out with the replacement to it. It's called Creating Healthy Schools and Communities. This is a very detailed grant, and we don't have enough of a population to go for this grant alone, so we're partnering with Franklin County. The schools are designated by New York State that are even able to take this grant. They are Elizabethtown, Mariah, and Ticonderoga school districts. We're partnering with North Country Health Heart Network to apply for this grant. The grant will be for $250,000, and we will get a portion of it to be defined, and we would continue. We're hoping to use Meg Parker, probably not a full-time job. I will adjust her salary to the amount of the grant if we're awarded it. So I'm just looking for a resolution to apply for the grant.
Moved by Mr. Goodell. Do we have a second? Mr. Merrihew. Discussion? Linda, is that a full grant or is that a matching grant? Do we know?
Full.
Full grant.
Full grant. And we're hoping to get anywhere, we're negotiating between $55,000 and $75,000. That'll be a year to work in those 3 school districts. So it'll be, we're hoping to make some real changes there.
Thank you. Any further discussion? If not, all in favor? Aye. Opposed? So carried. Anything else, Linda?
No.
Any questions for public health? Mr. Douglas.
Just a comment on the, I know the Ebola thing is toning down a little bit, but again, I just want to say how much Linda was out in front of that whole thing. I know you work with Patty and everybody else, and Don and Dan, but you were so far out in front of it to prepare Essex County, and I'm proud of your efforts.
Thank you very much. I have to say, E-Town did a drill last week, continued doing a drill. We still monthly don and doff. And Jessica Darney-Buehler yesterday, I should also announce that Jessica Darney-Buehler has taken the position of our preparedness coordinator. We're so thrilled to have her doing that. And she was in Albany yesterday for an entire Ebola update and what counties are going through. And just because you don't hear about it, don't think that they're still not arriving at the airports. Lots of people still come in daily from those countries into New York City and move around New York State. not freely. We are very, very good at quarantining people, so we're doing good.
As long as I'm handing out kudos, again, it goes to the Sharon, and I've been chair for the last 5 years, and one thing when I became chairman and Dan became the county manager, it was about department head meetings, and Dan's been having them on a regular basis and sharing ideas and concerns such as Ebola, where all the departments are aware, everybody's sharing information, and so that goes to you too, Dan, for making sure that they will stay in place and making sure that everybody's sharing good ideas and concerns, and that was one of them. So thank you.
Thank you.
Any further questions or concerns? If not, thank you, Linda. Office of the Aging, Patty Badger. Morning, Patty.
Thank you.
Good morning, everybody. I have nothing to request. I just need some input and some feedback. As most of you guys know or remember, we went to a resolution the last Human Services meeting for an additional $6,000 from contingency for the transportation program, and we're going to just barely squeak by covering, and that's triaging, and the transportation department doing one heck of a job to make sure that we use the appropriate and easiest and cheapest way to transport somebody. Well, next year, looking forward already, I've had a conversation with Mercy Care out of Lake Placid with the fact that we are probably going to be over budget again next year. With Ticonderoga not having the bus down there anymore, it has significantly increased the demand for the services. Right now, and Nancy, I'm going to nod to you if I'm saying anything wrong because everything goes through Nancy, but right now there's no dialysis patients out of Ty right now. There's an under 60 requesting services, but that money doesn't cover that person. So, and there's a mechanism in place to get that person covered. So Mercy Care suggested, right now we're paying 56 cents the federal rate a mile to reimburse these volunteer, often senior drivers to do the transportation. So their suggestion is to decrease the mile per hour pay to stretch the money out further. It's a conundrum for me because I know some of these people, in particular, are elderly drivers on a fixed income and are using this money to help also, augment their current situation. So I'm a little bit between a rock and a hard place in the fact that, yes, if we did reduce the rate, it would stretch the money a little bit further. However, the person that's going to impact is a senior again. So I just want some guidance from you guys. And the reason I'm coming is because when we did this years and years ago, and probably only a few of you are going to remember because not everybody was still around the board then, it was a board's decision to do the federal rate. I didn't have to keep coming back every year. They just chose the federal rate. So again, I'm looking to you guys for some guidance on what to do with this.
Questions?
Oh, that's helpful.
I would guess that when we, during our organizational meeting, we decide what the rate's going to be for transportation purposes, right?
No, well, not for these guys because they're volunteers.
It's a separate resolution that's on the books. Excuse me. It's a separate resolution that's on the books that we're going to reimburse at the federal rate for mileage. I mean, you could change that, certainly, and you could do it at any meeting.
I guess what I'm saying is if we maintain the federal rate of 56.5 or 56, whatever it is, then this year will remain at 56.
Unless you do a resolution otherwise.
Unless we do a resolution. That's what I'm trying to say.
You got John?
Mr. Please.
The issue really isn't the rate. The issue is the money, right?
Correct.
So,
We're just trying to come up
what are
with...
you short?
Yeah, that's the question.
What are you short?
Well, this year we came back to you guys for $6,000, and if it weren't for the transportation department clearly doing the best work they could do to make sure that they spent that wisely, we would clearly use that up already. As a matter of fact, for Mercy Care, and correct me if I'm wrong, for November and December, we're not reimbursing the drivers, and they know that before they took the transportation.
So did you build this into your budget? For next year?
What we did was we are not going to go through ACAP next year as the pass-through agency, so that puts another $3,000 into our budget. Short of me going to overmatch by the county, we kept the same rate plus the $3,000 for next year.
John, you have a question?
Not a question, just I think the IRS rate has a separate rate for medical transportation.
It does, and it's much lower.
Thank you.
The other thing we are doing, Mr. Politi, the other thing we're doing is we are going to the United Way and asking for a grant again, Nancy's looking at other avenues as
I
well.
just don't understand why we just don't build those additional funds into your budget.
Well,
I mean, it's not, you aren't talking about a lot of money, are you?
Nancy?
I mean, based upon what I see in this budget and what all department heads want, to me, this is probably a very needed
Right.
budgetary item.
So let me just give you a little bit more history.
Am I wrong here?
Well, no, again, I don't disagree that you could build it into the budget, but ultimately, and this is what I said to every department head that we've gone around and cut every one of their accounts, is we said, okay, we've got a contingent account. If you run out, come back to us.
Okay.
So I think that may be the appropriate response at this time, is if the board is not going to lower that rate from the 56, then chances are in November or December next year, you're going to be looking at adding more money from the contingent account to carry this program.
Yeah, and I guess the question is, have we built in an appropriate contingency amount to cover something like this?
Yeah, I think we have. Our overall contingency has held pretty good over the last 5 years or so.
Yeah.
We've lowered it. We at one time were way over on the contingent, but we've kept it pretty tight.
I don't see the adjusting the rate as a minor tool, but
Right. And I don't think my opinion is, I hate to hurt the people that are doing the transportation.
I think we all agree with it.
Right.
Mr. Morrow?
This is mileage rate for seniors that are driving their own vehicles, right?
Right.
Okay. I wouldn't support cutting it because you are hurting the seniors that are on a fixed income. The mileages sounds good, but that's to pay for their fuel and then
And
if
wear
their
and tear.
Wear and tear, and if their car breaks down, they've got to take that money to fix their vehicle.
Right.
We're not going to pay for it. So I don't think it's fair. Find the money somewhere else, but I don't think we should.
Right. And I'm totally supportive of that. Mercy Care just really wanted me to bring it to you guys.
Any other concerns? Thanks, Ben.
Thank you.
Transportation, Nancy Dugal. Morning, Nancy.
I have one resolution. We did it last Human Service, but for some reason, I guess it got lost in the shuffle from Ways and Means and Full Board, so I wanted to bring it back to Human Service again. It's 5311 funding. It's a supplement.
I honestly don't think you need to redo the resolution. I think you can, because it was already a resolution through committee, it's on the books, you just have to relist it for that year-end meeting at the end of the month, and I think you'll be fine.
Anything else, Nancy?
No, that's all. Thank you.
Any questions for transportation? Thank you.
You're welcome.
Thanks, Dan. Mental health, Steve Valley.
Morning, everybody. I do have a few resolutions today, but before that, I wanted to introduce the committee to Dove Rappaport, our new psychiatrist, who's been with us since beginning of November, I think, early on. So again, this is Dr. Rappaport. We're very happy to have him on board. comes to us with a wealth of experience and is going to be a very great asset for us and the whole county. So,
Thank you, Steve. Thank you, everybody, for having me.
Where's Scazafava when we need him?
Steve?
I just like to thank Steve. Steve put in a lot of work in order to find the right person to fit into Essex County. And being on the Community Services Board, I know exactly what transpired and the number of times that he thought he had somebody, and then it wasn't the right fit, or that person decided that they didn't want to come to Essex County. So, Doctor, thank you for coming.
Thank you very much.
I understand you may be retired, but you're putting in some more work.
I'm enjoying it.
Okay, thank you.
okay, thank you. Okay, so my first request is for a resolution, actually, to authorize the appointment of Dr. Rappaport as a Director of Community Services designee physician in accordance with New York State mental hygiene law. This is something we've done, I think, a couple of months ago. I had a number of people. I do this periodically. This is to allow for safe transportation and evaluation of acutely psychiatric patients at local hospitals.
Moved by Mr. Merrihute, seconded by Mr. Paliti. Discussion? All in favor? Aye. Opposed? Carried.
All right, great. And the second one is also another somewhat routine resolution. This is for appointments to the Community Services Board, and these are all folks who are actually being reappointed, so their terms are ending, 4-year terms are ending at the end of the year. So I'm requesting a resolution authorizing the appointment of the following as members of the Essex County Community Services Board and/or its subcommittees, all for terms effective January 1, 2015 through December 31 of 2018. So I have Brian Amell of Saranac Lake to the Alcohol and Substance Abuse Subcommittee, George Anderson of Mariah to the Community Services Board, Marty Nephew of Mariah to the Developmental Disabilities Subcommittee, John O'Neill of Saranac Lake to the Community Services Board and the Mental Health Subcommittee, Doug Turbeek of Ticonderoga to the Alcohol and Substance Abuse Subcommittee, and Karen White of Lake Placid to the Mental Health Subcommittee.
Would somebody like to move those names? Mr. Grinnell, seconded by Mr. Merrihute. Discussion. Mr. Paliti.
Steve, I'm just curious, where do the nominations for these individuals come from?
The nominations come from the Community Services Board. So maybe the question is, how do we go about selecting people? Or
Yes, how do you come up with these names? I mean, I
Okay.
understand John O'Neill.
Okay.
But I'm curious about the other names. Who comes up with these names?
Well, the board itself has a recruitment committee, and so we basically are networking with all the board members and with all the providers in our service system to identify folks who have an interest in the community and in services for the mentally disabled.
So all of these folks that are on these committees have some type of a relationship with the entities that they represent or the committees they will represent. They're already involved in those type of programs?
Yes, they are to a large degree. And we also have a mandate from the state to have people on our board who have actually been recipients or involved with services.
Thank you.
Any further questions? Being none, all in favor? Aye. Opposed? Carried. Anything else, Steve?
Nothing else.
Any questions for mental health? Thank you.
Thanks.
Mr. O'Neill? Congratulations.
Thank you. I just have one resolution request, $11,000 in appropriations and revenue for non-domestic violence grant.
Moved by Mr. Politi. Do we have a second? Mr. Gilliam? There's a shadow there. Discussion. All in favor? Opposed? Carried. Anything else, John?
I also want to thank Dan for the department head meetings. They're great opportunities to network with and see face to face with our colleagues. So I really appreciate it. I wish I could get everybody to do a group hug at the end, but I'm still working on it. Okay, that's it.
Any questions for John? Hold on a second. Mr. Grinnell?
It's been discovered in my community, I think several others, that there is a group of people that are fondly referred to as the drug taxis, which involve local people getting prescriptions for pain-killing drugs that in order to get the prescriptions and get them filled, they have to attend a physician's workshop or a physician's place of business outside of their local communities down in the Albany area. And it's been brought to our attention that those taxis are being funded by social services. I wonder if that's a fact or if that's a rumor or...
Well, not social services. They would be approved, the runs would be approved and paid for by the state now. So it's Medicaid dollars, but it's not, the social services, our department doesn't approve those rides. It's all done centrally now. The state is coordinating that. We have two drivers. We drive people ourselves, but we don't do any runs like that we're aware of.
These are taxis,
right.
Livery services that are hired and paid for, and the reports that I know myself and some supervisors have been getting, that is being paid for by social services. I found that a little hard to believe. I just wanted to know the source.
It is, it's Medicaid, not Essex County Social Services. I also do want to say, Mr. Grinnell, that I did speak with a chief investigator for OMIG a few months ago about this, and he then hooked him up with the chief of police down there. Maybe you've heard this, and they talked, and so that I thought that was a very important kind of connections, because obviously they need concrete information to work with. So, and I've also spoken with Doug Turbeek from Substance Abuse Team about it, so that we're kind of all aware of what we think is the issue, but a lot of dynamics.
They're coming up with some very ingenious ways of dealing with it. We're actually, my community is actually going to pass a law regulating livery services in Ticonderoga so that we can, it's not all livery services that are a problem. There are certain ones that are known for being an issue and others that are just legitimate businesses. We're going to try and weed out the chaff from the wheat, so to speak.
I could also, if you want, I can also give you the contact person for State Department of Health, Medicaid Transportation, and I think that would be an important conversation to have with them, because they are, they've got the contract with the organization out of Syracuse that's coordinating the rides. So I'll get that to you.
That's who we need to get to.
Okay.
Anything else for Mr. O'Neill? If not, thanks, John. Is there anything else to come before Human Services? Yes. If not,